Number 2, Bruce Banner, the hole. This one's a little obvious, but he probably has an intermittent explosive disorder there as a reason for why he is blowing up and turning into a gigantic rage monster thing, to quote Tony Stark. So I think we can kind of leave it at the intermittent explosive disorder for his diagnosis. Now, what should he be doing? Obviously, some sort of CBT, again, cognitive behavioral therapy or dialectical behavioral therapy to help control his outbursts, understand his triggers, that kind of stuff. Understanding how to use things like diaphragmatic breathing or monitoring his heart rate variability and his heart rate, which is actually what he does in, I think it was the Incredible Hulk, to train himself to control his explosions and, turning into Hulk. Supplement-wise, what he should be doing, maybe ashwagandha for calm and those sorts of things. Looking at things again like L-theanine, potentially kava root can be beneficial here for the more acute effect on GABA receptors, that calming aspect. Glycine as well. Glycine is another amino acid, part of the, like a magnesium glycinate kind of thing, for calm and sleep and that sort of thing. But what might he be taking? If we're for the green stuff that was injected into him, if it's for all induced by peptides and whatnot, what might be causing the problem here? I'm looking at something like an IGF-1 LR3. We'll call those gamma gains on the peptide side of things.
Alex, it's okay when things pop in your head to let them stay there. Not everything needs to be said. Yes, put your head down in shame.
What this does is it is downstream effect, like the benefits essentially of IGF-1 or thing about high growth hormone levels at the muscle level in particular, but it has some insulin-like effect, so it can drop your blood sugar too. That's why it's not very widely used and has some additional risks beyond what you would expect for something more growth hormone directed upstream from that. On the hormonal side, he's probably taking something like a Trenbolone. Trenbolone is an anabolic steroid used a lot by bodybuilders because it can promote some serious gains, but comes with some serious psychiatric effects. Dr. Mike Israetel was recently talking about his experience with Trenbolone and how at the high enough doses he had urges to hurt people. So it kind of fits. Most likely too, going back to a video that I just did in terms of my stack, likely has some sort of estrogen suppression in the mix too, because that's going to give you less opposition to the amplifying effects of testosterone in terms of assertiveness and perceived, slights and that kind of thing. So without the estrogen there, you're more likely to have the irritability and that explosion and that kind of thing too. So he's probably on some Trenbolone, maybe some anastrozole to suppress the estrogen, and it's running away from him.